Okay, that first cup of coffee in the morning, for so many of us, it's just essential, right? But maybe you've seen some pretty alarming headlines recently. Stuff linking instant coffee to vision loss. Well, a lot of you asked about one specific study, so we wanted to cut through the noise. And we've got Professor Lynn's analysis here to help us do that. Our mission today is really to deep dive into this, look at the sources, and maybe give you some tools for critical thinking.
Absolutely. And what's fascinating here really is how quickly just one study, often, let's be honest, not the most robust study,
Yeah.
can spark this huge wave of concern.
So yeah, today we're going to unpack the science behind it. We want to debunk this myth that seems to be spreading and hopefully help you figure out how to evaluate these kinds of health claims yourself.
Right. So let's get straight to it. The big alarm bell was a 2025 study. It was published in Food Science and Nutrition. And it made this, well, pretty dramatic claim, didn't it? Suggesting regular instant coffee drinking could potentially increase the risk of dry, age-related macular degeneration, AMD. And the increase wasn't small, nearly 7 times. 7 times. Yeah, that's a number that grabs attention.
Exactly. Now, other doctors have sort of speculated why this might happen. They point to things like acrylamide, which, forms when you cook certain foods at high temps, and also these advanced glycation end products, AGEs, from manufacturing. The thinking is these might cause oxidative stress, maybe inflammation in the retina. But Professor, when you see a claim that stark, like 7 times, what's the first thing that, jumps out?
Honestly, my first thought goes straight back to Paracelsus, the father of toxicology. His fundamental principle, only the dose makes the poison. It's absolutely crucial. And this 2025 study, the one making all the headlines, despite that alarming number, it never provided any data, none at all on the dosage. How much instant coffee are we talking about to get this supposed 7-fold risk? We just don't know.
Wow, okay, so no dosage. That feels like a pretty major hole, doesn't it? Especially when you compare it, like you said, to maybe other research. There was that 2023 study, right, from the UK Biobank. Consumption of coffee and tea is associated with macular retinal nerve fiber layer thickness. Bit of a mouthful. But that study actually did categorize coffee drinking. It had groups like half to 1 cup, 2 to 3 cups, 4+ cups daily.
Precisely. They quantified it.
And what did they find? Something quite different, wasn't it?
Completely different, actually. They found a positive association, an increase in that macular retinal nerve fiber layer thickness, which is generally a good sign for eye health. And this was especially noticeable for people drinking 2 to 3 cups a day. So the opposite conclusion, really.
Or opposite, wow. And the problems with the 2025 study didn't stop at dosage, did they? You mentioned something else.
Yeah, it didn't even clearly define what instant coffee means in their context. I mean, is it a 3-in-1 mix loaded with sugar and creamer? Is it plain black instant coffee? Does the bean origin matter? The processing, these things can have hugely different biochemical profiles. It's just vague.
So the methodology itself sounds a bit shaky. Just analyzing existing database info from questionnaires, Professor Lynn called that a lower-level form of research for, setting actual health guidelines, which raises a big question for me. If this risk is genuinely 7 times higher, I mean, that's massive. Why aren't we hearing warnings from, say, the FDA or the American Academy of Ophthalmology?
Exactly my point. You'd expect major health bodies to react to such a dramatic finding if it were well supported. But when studies lack these crucial details, dose, clear definitions, robust methodology, what often happens is they just become, well, spitwad fodder, as Professor Lynn put it. Great for generating clicks and shares on social media, maybe giving commentators something to talk about, but not necessarily solid science. It's essentially clickbait dressed up as research.
Right, clickbait. Okay, so we've kind of picked apart the scary headline. We've looked at the flaws. So what does this all mean for you, the listener? Especially if you actually enjoy your cup of instant coffee. What are Professor Lynn's practical takeaways?
Well, based on his analysis and acknowledging the science isn't totally clear-cut yet, he offers a few personal evidence-based recommendations. Just sensible guidelines, really. First, if it's practical for you, maybe try switching to coffee made from ground, brewed beans when you can. This might help reduce exposure to some compounds, like acrylamide, which can be higher in some instant coffees because of how they're processed.
Okay, brewed when possible. What else?
Second, go for black coffee if you can, whether it's instant or ground. Avoid all the added sugar and creamer. Those extras bring their own health baggage,
Makes sense. And the amount.
And third, try to stick to no more than about 3 cups a day. This aligns pretty well with general health advice on caffeine intake anyway. It's a reasonable limit.
Got it. Brewed when possible. Black if you can. And keep it under 3 cups. Seems straightforward. So really, the big lesson here isn't just about coffee, is it? It's more about that critical thinking muscle, especially when these dramatic health headlines pop up, knowing how to pause and question what you're reading.
That's exactly it. And maybe a final thought to leave you with. The real insight isn't always just in the headline or the conclusion of a study. It's often hidden in how the research was done. What details are missing? What questions didn't they ask or answer? Understanding that gives you the power to make genuinely informed choices, not just about your coffee, but about pretty much any health claim that comes your way.